My name is Roger Simpson. I'm currently the director of the Burn Center at Nassau University Medical Center. I'm a plastic surgeon on Long Island, and my practice really takes care of a lot of reconstructive patients and a lot of edge. This is the profession I chose, and the fact that every day I can experience it over and over again is absolutely wonderful. Plus the fact that we run a teaching program, both a residency in plastic and reconstructive surgery and a fellowship in burn surgery. And being able to teach on a daily basis just makes every day a wonderful day. The role models that I've had are the people who forced me to really take on an extremely high standard of care. They were focused on detail, they were creative, they knew the boundaries, and they knew how to take care of patients. And Dr. Hajhosseini came to us looking at our burn fellowship. He had completed some excellent work at Stanford University in wound healing, and we offered a fellowship in burn care and complex wound healing. He was the perfect mix for what we were looking for. The patient load was something that he had experience in, and his interest in the surgery of burns made this an ideal match for our position. And these wounds that they're treating are extremely difficult, from the very, very severe chronic diabetic wounds or pressure wounds to the acute burn. All of this is all about scar and contraction and knowing how to modify it in the best fashion possible. You're looking also at a timely treatment so that these patients can get better, become more active in the least possible. I think Dr. Hajhosseini has had excellent training at very high levels. He's done critical wound healing, and he's done research in wound care, all of this geared to getting a faster and better outcome for his patients. He's added to his education by spending a year with us in acute burn care, understanding how to manage these patients, not only at the time of their burn injury, but also in the years that follow. A burn surgeon and a wound surgeon cares for patients not just in the acute period, but in the follow-up period, which is for burns, sometimes for life. Very important that he's well versed in scar contraction, how to improve function. I think he's got the training. Burns are extremely difficult to care for, and it really takes a multidisciplinary team. I think the most important thing is to get early help. If a burn is extremely superficial and you're comfortable with that, then that's fine. But if a burn is more than something that's small, get a professional to take a look at that. Certainly someone in the field of burns who can reassure you that that burn will heal with the right treatment. A burn can become deeper if it's neglected. Just covering it up with a homemade remedy may not be the ideal situation. So I think that's the most important thing I can share, is that see a professional and get some good understanding of the burn depth and the healing process.